Question 1. 10 minutes after an 85-year-old woman collapses, paramedics arrive and start CPR for the first time. The monitor shows fine, low amplitude, VF. Which of the following actions should they take next? A. Perform at least 5 minutes of vigorous CPR before attempting defibrillation. B. Insert an endotracheal tube, administer 2 to 2.5 mg epinephrine in 10 ml NS through the tube and then defibrillate. C. Deliver up to 3 precordial thumps while observing the patient's response on the monitor. D. Deliver about 2 minutes or 5 cycles of CPR, and deliver a 360J monophasic or equivalent current biphasic shock. Answer: D. Deliver about 2 minutes or 5 cycles of CPR, and deliver a 360J monophasic or equivalent current biphasic shock. Question 2. A cardiac arrest patient arrives in the ED with PA at 30 bpm. CPR continues, proper tube placement is confirmed, and 4 access is established. Which of the following medications is most appropriate to give next? A. Calcium chloride 5 ml of 10% solution 4. B. Epinephrine 1 mg 4. C. Synchronized cardioversion at 200 J. D. Sodium bicarbonate 1 milliequivalent/kg 4. Answer: B. Epinephrine 1 mg 4. Question 3. Which of the following actions helps deliver maximum current during defibrillation? A. Place alcohol pads between the paddles and skin. B. Reduce the pressure used to push down on the defibrillator paddles. C. Apply conductive paste to the paddles. D. Decrease shock energy after the second shock. Answer: C. Apply conductive paste to the paddles. Question 4. Which of the following actions is not performed when you clear a patient just before defibrillator discharge? A. Check the person managing the airway, body not touching bag mask or tracheal tube, oxygen not flowing directly onto chest. B. Check yourself, hands correctly placed on paddles, body not touching patient or bed. C. Check monitor leads, leads disconnected to prevent shock damage to monitor. D. Check others, no one touching patient, bed, or equipment connected to patient. Answer: C. Check monitor leads, leads disconnected to prevent shock damage to monitor. Question 5. A woman with a history of narrow complex PSVT arrives in the ED. She is alert and oriented but pale. HR is 165 bpm and the ECG documents SVT. BP is 105/70 mmHg. Supplemental oxygen is provided, and 4 access has been established. Which of the following drug dose combinations is the most appropriate initial treatment? A. Adenosine 6 mg rapid 4 push. B. Epinephrine 1 mg 4 push. C. Synchronized cardioversion with 25 to 50 J. D. Atropine 1 mg 4 push. Answer: A. Adenosine 6 mg rapid 4 push. Question 6. Which of the following facts about identification of VF is true? A. A peripheral pulse that is both weak and irregular indicates VF. B. A sudden drop in blood pressure indicates VF. C. Artifact signals displayed on the monitor can look like VF. D. Turning the signal amplitude, gain, to 0 can enhance the VF signal. Answer: C. Artifact signals displayed on the monitor can look like VF. Question 7. Endotracheal intubation has just been attempted for a patient in respiratory arrest. During bag mask ventilation you hear stomach gurgling over the epigastrium but no breath sounds, and oxygen saturation, per pulse oximetry, stays very low. Which of the following is the most likely explanation for these findings? A. Intubation of the esophagus. B. Intubation of the left main bronchus. C. Intubation of the right main bronchus. D. Bilateral tension pneumothorax. Answer A. Intubation of the esophagus. Question 8. Which of these statements about administration of medications during attempted resuscitation is true? A. Give epinephrine via the intracardiac route if access is not obtained within 3 minutes. B. Follow 4 medications through peripheral veins with a fluid bolus. C. Do not follow 4 medications through central veins with a fluid bolus. D. Run normal saline mixed with sodium bicarbonate, 100 milliequivalent/L, during continuing CPR. Answer B. Follow 4 medications through peripheral veins with a fluid bolus. Question 9. A 60-year-old man, weight equals 50 kilograms, with recurrent VF has converted from VF again to a wide complex non-perfusing rhythm after administration of epinephrine 1 mg 4 and a third shock. Which of the following drug regimens is most appropriate to give next? A. Amiodarone 300 mg 4 push. B. Lidocaine 150 mg 4 push. C. Magnesium 3G 4 push, diluted in 10 ml of D5W. D. Procainamide 20 mg per minute, up to a maximum dose of 17 mg per kilogram. Answer A. Amiodarone 300 mg 4 push. Question 10. While treating a patient in persistent VF arrest after 2 shocks, you consider using vasopressin. Which of the following guidelines for use of vasopressin is true? A. Give vasopressin 40 U every 3 to 5 minutes. B. Give vasopressin for better vasoconstriction and beta-adrenergic stimulation than that provided by epinephrine. C. Give vasopressin as an alternative to a first or second dose of epinephrine in shock-refractory VF. D. Give vasopressin as the first-line pressor agent for clinical shock caused by hypovolemia. Answer C. Give vasopressin as an alternative to a first or second dose of epinephrine in shock-refractory VF. Question 11. Which of the following causes of PA is most likely to respond to immediate treatment? A. Massive pulmonary embolism. B. Hypovolemia. C. Massive acute myocardial infarction. D. Myocardial rupture. Answer B. Hypovolemia. Question 12. Which of the following drug dose combinations is recommended as the initial medication to give a patient in asystole? A. Epinephrine 3 mg 4. B. Atropine 3 mg 4. C. Epinephrine 1 mg 4. D. Atropine 0.5 mg 4. Answer C. Epinephrine 1 mg 4. Question 13. A patient with a heart rate of 40 BPM is complaining of chest pain and is confused. After oxygen, what is the first drug you should administer to this patient while a transcutaneous pacer is brought to the room? A. Atropine 0.5 mg. B. Epinephrine 1 mg 4 push. C. Isoproterenol infusion 2 to 10 mg/min. D. Adenosine 6 mg rapid 4 push. Answer A. Atropine 0.5 mg. Question 14. Which of the following statements correctly describes the ventilations that should be provided after endotracheal tube insertion, cuff inflation, and verification of tube position? A. Deliver 8 to 10 ventilations per minute with no pauses for chest compressions. B. Deliver ventilations as rapidly as possible as long as visible chest rise occurs with each breath. C. Deliver ventilations with a tidal volume of 3 to 5 milliliters per kilogram. D. Deliver ventilations using room air until COPD is ruled out. Answer A. Deliver 8 to 10 ventilations per minute with no pauses for chest compressions. Question 15. A patient in the ED reports 30 minutes of severe, crushing, substernal chest pain. BP is 110/70 mmHg, HR is 58 bpm, and the monitor shows regular sinus bradycardia. The patient has received aspirin 325 mg PO, oxygen 4 liters per minute via nasal cannula, and 3 sublingual nitroglycerin tablets 5 minutes apart, but he continues to have severe pain. Which of the following agents should be given next? A. Atropine 0.5 to 1 mg 4. B. Furosemide 20 to 40 mg 4. C. Lidocaine 1 to 1.5 mg per kilogram. D. Morphine sulfate 2 to 4 mg 4. Answer D. Morphine sulfate 2 to 4 mg 4. Question 16. Which of the following agents are used frequently in the early management of acute cardiac ischemia? A. Lidocaine bolus followed by a continuous infusion of lidocaine. B. Chewable aspirin, sublingual nitroglycerin, and 4-morphine. C. Bolus of amiodarone followed by an oral ACE inhibitor. D. Calcium channel blocker plus 4 furosemide. Answer B. Chewable aspirin, sublingual nitroglycerin, and 4-morphine. Question 17. A 50-year-old man who is profusely diaphoretic and hypertensive complains of crushing substernal chest pain and severe shortness of breath. He has a history of hypertension. He chewed 2 baby aspirins at home and is now receiving oxygen. Which of the following treatment sequences is most appropriate at this time? A. Morphine then nitroglycerin, but only if morphine fails to relieve the pain. B. Nitroglycerin then morphine, but only if ST elevation is greater than 3 mm. C. Nitroglycerin then morphine, but only if nitroglycerin fails to relieve the pain. D. Nitroglycerin only, because chronic hypertension contraindicates morphine. Answer C. Nitroglycerin then morphine, but only if nitroglycerin fails to relieve the pain. Question 18. A 50-year-old man has a 3 mm ST elevation and leads V2 to V4. Severe chest pain continues despite administration of oxygen, aspirin, nitroglycerin SL times 3, and morphine 4 mg 4. BP is 170/110 mmHg, HR is 120 bpm. Which of the following treatment combinations is most appropriate for this patient at this time? Assume no contraindications to any medication. A. Calcium channel blocker 4 plus heparin bolus 4. B. ACE inhibitor 4 plus lidocaine infusion. C. Magnesium sulfate 4 plus enoxaparin, Lovenox, SQ. D. Fibrinolytic plus heparin bolus 4. Answer D. Fibrinolytic plus heparin bolus 4. Question 19. A 70-year-old woman complains of a moderate headache and trouble walking. She has a facial droop, slurred speech, and difficulty raising her right arm. She takes several medications for high blood pressure. Which of the following actions is most appropriate to take at this time? A. Activate the emergency response system. Tell the dispatcher you need assistance for a woman who is displaying signs and symptoms of an acute subarachnoid hemorrhage. B. Activate the emergency response system. Tell the dispatcher you need assistance for a woman who is displaying signs and symptoms of a stroke. C. Activate the emergency response system. Have the woman take aspirin 325 mg and then have her lie down while both of you await the arrival of emergency personnel. D. Drive the woman to the nearby ED in your car. Answer B. Activate the emergency response system. Tell the dispatcher you need assistance for a woman who is displaying signs and symptoms of a stroke. Question 20. Within 45 minutes of her arrival in the ED, which of the following evaluation sequences should be performed for a 70-year-old woman with rapid onset of headache, garbled speech, and weakness of the right arm and leg? A. History, physical and neurologic exams, non-contrast head CT with radiologist interpretation. B. History, physical and neurologic exams, non-contrast head CT, start of fibrinolytic treatment if CT scan is positive for stroke. C. History, physical and neurologic exams, lumbar puncture, LP, contrast head CT if LP is negative for blood. D. History, physical and neurologic exams, contrast head CT, start fibrinolytic treatment when improvement in neurologic signs is noted. Answer A. History, physical and neurologic exams, non-contrast head CT with radiologist interpretation. Question 21. Which of the following rhythms is a proper indication for transcutaneous cardiac pacing? A. Sinus bradycardia with no symptoms. B. Normal sinus rhythm with hypotension and shock. C. Complete heart block with pulmonary edema. D. Asystole that follows 6 or more defibrillation shocks. Answer C. Complete heart block with pulmonary edema. Question 22. Which of the following causes of out-of-hospital asystole is most likely to respond to treatment? A. Prolonged cardiac arrest. B. Prolonged submersion in warm water. C. Drug overdose. D. Blunt multisystem trauma. Answer C. Drug overdose. Question 23. A 34-year-old woman with a history of mitral valve prolapse presents to the ED complaining of palpitations. Her vital signs are as follows: HR equals 165 BPM, RESP equals 14 per minute, BP equals 118/92 mmHg, and O2 set equals 98%. Her lungs sound clear, and she reports no shortness of breath or dyspnea on exertion. The ECG and monitor display a narrow complex, regular tachycardia. Which of the following terms best describes her condition? A. Stable tachycardia. B. Unstable tachycardia. C. Heart rate appropriate for clinical condition. D. Tachycardia secondary to poor cardiovascular function. Answer A. Stable tachycardia. Question 24. A 75-year-old man presents to the ED with a 1-week history of lightheadedness, palpitations, and mild exercise intolerance. The initial 12-lead ECG displays atrial fibrillation, which continues to show on the monitor at an irregular HR of 120 to 150 BPM and a BP of 100/70 mmHg point. Which of the following therapies is the most appropriate next intervention? A. Sedation, analgesia, then immediate cardioversion. B. Lidocaine 1 to 1.5 mg per kilogram for bolus. C. Amiodarone 300 mg for bolus. D. Seek expert consultation. Answer D. Seek expert consultation. Question 25. You prepare to cardiovert an unstable 48-year-old woman with tachycardia. The monitor/defibrillator is in synchronization mode. The patient suddenly becomes unresponsive and pulseless as the rhythm changes to an irregular, chaotic, VF-like pattern. You charge to 200J and press the shock button, but the defibrillator fails to deliver a shock. Why? A. The defibrillator/monitor battery failed. B. The sync switch failed. C. You cannot shock VF in sync mode. D. A monitor lead has lost contact, producing the pseudo-VF rhythm. Answer C. You cannot shock VF in sync mode. Question 26. Vasopressin can be recommended for which of the following arrest rhythms? A. VF. B. asystole. C. P. D. All of the above. Answer, D. All of the above. Question 27. Effective bag mask ventilations are present in a patient in cardiac arrest. Now, 2 minutes after epinephrine 1 mg 4 is given, PA continues at 30 bpm. Which of the following actions should be done next? A. Administer atropine 1 mg 4. B. Initiate transcutaneous pacing at a rate of 60 bpm. C. Start a dopamine 4 infusion at 15 to 20 mg/kg per minute. D. Give epinephrine, 1 ml of 1-10-000 solution, for bolus. Answer, A. Administer atropine 1 mg 4. Question 28. The following patients were diagnosed with acute ischemic stroke. Which of these patients has no stated contraindication for 4-fibrinolytic therapy? A. A 65-year-old woman who lives alone and was found unresponsive by a neighbor. B. A 65-year-old man presenting approximately 4 hours after onset of symptoms. C. A 65-year-old woman presenting 1 hour after onset of symptoms. D. A 65-year-old man diagnosed with bleeding ulcers 1 week before onset of symptoms. Answer, C. A 65-year-old woman presenting 1 hour after onset of symptoms. Question 29. A 25-year-old woman presents to the ED and says she is having another episode of PSVT. Her medical history includes an electrophysiologic stimulation study (EPS) that confirmed a reentry tachycardia, no Wolff-Parkinson-White syndrome, and no pre-excitation. HR is 180 bpm. The patient reports palpitations and mild shortness of breath. Vagal maneuvers with carotid sinus massage have no effect on HR or rhythm. Which of the following is the most appropriate next intervention? A. DC cardioversion. B. 4-diltiazem. C. 4-propranolol. D. 4-adenosine. Answer, D. 4-adenosine. Question 30. A patient with an HR of 30 to 40 bpm complains of dizziness, cool and clammy extremities, and dyspnea. He is in third-degree AV block. All treatment modalities are present. What would you do first? A. Give atropine 0.5 to 1 mg 4. B. Give epinephrine 1 mg 4 push. C. Start dopamine infusion 2 to 10 mg/min. D. Begin immediate transcutaneous pacing, sedate if possible. Answer, D. Begin immediate transcutaneous pacing, sedate if possible.